Well, first of all, Annette, I want to say thank you very much for agreeing to get back together again. It's been some time.
Yes.
It's a delight, and thank you so much for your video, for your review. It was very nice.
Yes.
Almost seemed like you were speaking about somebody else, but I really appreciated the kind words you had to say about us.
Yes.
And about Dr. Totariello and I. We really appreciate it.
Yes, of course. I mean, I I don't know like how much to thank you, you know? So.
Well, you needn't thank me. I always tell people, man proposes and God disposes. You've been through a lot. Your time had come. This was the right time for you.
Yes.
So I'm delighted for you. I really am delighted.
Yes.
First of all, I thought maybe a good way to go about this would be first to go over a little bit of your history.
Yes.
See if I've got it correct, because it's been some time.
Yeah.
And I did get a little bit of help from you earlier on.
Of course.
But I want to be sure that I've got things right.
Yes.
And we'll take it from there. You're 38 years of age.
Yes. Now. Yep.
Going on 39.
Yep.
You have a fertile male partner.
Yes.
You had been trying to have a baby for a number of years.
Yeah.
After having had a successful pregnancy in 2019.
Yes.
A normal, healthy baby born vaginally.
Baby, yeah, and it was 6 months of trying, got pregnant. So.
And you got pregnant quickly, and then you did a number of IUI procedures, 4 of them.
Yep.
And you were unsuccessful.
Yes.
And you went through a number of IVF attempts, 2 of which were cancelled.
Yes.
Because of very severely diminished ovarian reserve. You didn't produce a lot of eggs.
That's right.
And the follicles weren't growing, and so it was cancelled.
Yes.
And then ultimately in 2022,
yes,
you produced 2 eggs.
Yes.
One was mature, didn't survive.
Yes.
The other one was immature and matured up in the laboratory and propagated a normal, healthy embryo,
yes,
which ultimately resulted in this child that you subsequently had when you came to us later on.
Yes.
And I believe in June,
yes,
I did an egg retrieval on you.
Yes, you did.
And we ended up with 1 normal embryo.
Yes.
Which is still frozen.
Yes, it's still frozen.
So what we paid attention to was dealing with the embryo that had resulted from your previous attempt in February.
Yes.
That matured up and made a healthy, chromosomally normal embryo.
That's right.
And that's the one that we transferred in September.
Yes.
And resulted in a birth of a child.
Yes.
1 day before my birthday on the 15th of May. So I got a good birthday present. So that's basically how it went.
Yes.
Now, I was concerned about the fact that you'd been through all these IUIs and you didn't get pregnant.
Yes.
And we looked at the possibility, because in your family, there was also an immunologic disorder, Hashimoto's disease, which is an autoimmune thyroid condition.
That's right.
Which in 50% of cases is associated with an immunologic problem linked to the overproduction of immune cells that are activated, called natural killer cells, in the uterine lining. So I was suspicious that you might have an immunologic problem, for which we tested you.
Yes.
And you came positive with natural killer cells that were activated. We can talk about that in a few moments.
Yes.
But then ultimately, when someone has got activated natural killer cells, you always want to rule out the possibility that the cause was something other than the autoimmune thyroid condition that you had. So we tested you and your husband for similarities in your genetic makeup involving the gene DQ alpha HLA.
Yes.
And we found, to our surprise, in fact, that you were similar.
Yes.
We'll go into that in a few minutes.
Yes.
But the truth was that required a different approach to treatment.
That's right.
Which we used in your case.
Yes.
And you produced one, as I say, there was 1 embryo that was over, but we used the first embryo you produced.
Yeah.
Transferred that and treated you for the immune condition.
Yes.
And it worked.
It worked.
And then when you were pregnant,
yes,
you developed cervical incompetence. You told me you went to your doctor.
Right.
I remember you telling me, and your doctor discovered that the cervical length, the opening to your uterus, was shortening.
Yes.
And I suggested that very often is an ominous sign, can point towards something called cervical incompetence,
Yes.
where the cervix can just suddenly just open and the baby can be expelled.
Yes.
You took that to your doctor and he agreed.
Yes.
And he put a stitch in your cervix to close that
Yes.
looseness of the cervical canal.
Yes.
And you went through the pregnancy without a hitch.
Yeah.
And you gave birth, I believe this time, by cesarean section.
That's right. Yes.
And it was a beautiful, healthy baby.
Yeah, he went to 38 weeks and 6 days.
That's wonderful. And in large part, that's because that stitch was in place.
Yes. Oh boy, that was pretty difficult because I didn't know if they were going to ultimately approve it or not. But there was so much at stake with this pregnancy. But
I think there was something I left out, and that is that you did undergo the transfer of an embryo earlier on in the previous location.
Yes.
And that pregnancy was lost very early on in pregnancy.
Yes.
As an early pregnancy loss.
Yes.
And all those things together.
Yeah.
Your failure with IUI repeatedly.
Mm-hmm.
Your transfer that resulted in a chemical pregnancy.
That's right.
Plus your history of a predisposing factor towards autoimmune disease led us to do the immune testing.
That's right.
Which then made me realize we needed to go a bit further when that was positive. And then we found out that it was due to what we call an alloimmune cause rather than autoimmune.
That's right.
Am I on track with this?
You got it.
Okay. Yeah. It's great to see you smile because I remember you had a much more dismal, saddened look about your predicament some years back.
It was, I didn't know if there was going to be any hope for me. I said to myself, if Dr. Sher can't get me pregnant, I don't think it's going to happen.
Well, you're very kind. Let me point out that for somebody to get pregnant with IVF or by any other means, two things have to be working in your favor. The first is you have to plant a healthy seed, which is the embryo.
Yes.
And the second is that you're going to plant that seed in a receptive soil, which is the uterine lining.
Yes.
And it's the factors that determine the competency of the seed or the embryo, and the factors that determine the receptivity of the soil, the uterine lining, that determine outcome. And in your case, both those factors were awry. Number one, you had diminished ovarian reserve, which sets you up for compromised eggs. And the second was you had an immunologic problem involving the uterine lining, which made the uterus unreceptive.
Yeah.
So the way we had to deal with this to get you through this hitch, through this hurdle, was to use a protocol for ovarian stimulation that, in spite of your diminished ovarian reserve, would allow us to get a healthy egg out of you.
Yes.
And the second was to deal with the non-receptivity of the uterine lining, which is immunologic, to prevent that from serving as an impediment that would reject the embryo.
Right.
So we went about that by changing the protocol for ovarian stimulation.
Yes.
And instead of using clomiphene like you did in your previous cycle,
that's right,
which is not good for women with diminished ovarian reserve, you use clomiphene in combination with Menopur and Follistim.
Yes.
So we went ahead and eliminated the clomiphene, modified the dosage, changed the stimulation slightly, and we were able to come up with a nice, good egg. And since it's the egg and not the sperm that is primarily responsible for the health of the embryo, that was able to be done by modifying the protocol.
Yes.
Then when we put the embryo back in the uterus from the previous cycle, we basically had to accept the fact that there was an immunologic cause and address it.
Yeah.
Now, firstly, the way we determine if an egg is healthy and is of good quality, in large part today is done through chromosomal testing.
That's right. Yeah.
Where we do something called PGS or PGT testing of the embryo to make sure all the chromosomes are present. And this is a test that Dr. Tortoriello and I really pioneered and developed together. It's now used all over the world, but we were the first to develop it. It's now used to tell us if the embryo is of good quality.
Yeah.
That embryo was, so we knew we had a competent embryo.
Yes.
Now you've got to put a good seed in a good soil.
Right.
You can't put a good seed in a bad soil. And you can't put a bad seed in a good soil.
Yeah.
So now the issue was, how do we optimize the receptivity of the soil? And here we knew that you had activation of certain immune cells called natural killer cells, which are present in the uterine lining of all women.
Yeah.
These natural killer cells regulate the growth of the root system of the embryo into the wall of the uterus to form the lifeline of the baby, which is the placenta. And if there is not a receptive uterus, because these natural killer cells produce certain toxins we call Th1 cytokines that attack the embryo and damage the root system, if those are present, it'll interfere with the ability of the embryo's roots to attach. Here comes the issue. There are two causes of these, of the natural killer cells overproducing these Th1 cytokines. The one is the common variety, which is existent in 80% of women who have this problem, where it's autoimmune.
Yep.
And that's where I was thrown off with you, because you had a family history of autoimmune disease with your the thyroid condition.
Yes.
So I thought this was going to be autoimmune, which is easy to fix.
Right.
We were the first people to address that problem many years back.
Yeah.
And so we thought that the problem would be easily resolved by simply putting you on intralipid.
Right.
And giving you dexamethasone, which is a steroid.
Yes.
But if it was not autoimmune, but rather due to the other cause of activating natural killer cells, which we call alloimmune, there it's much more difficult.
Yeah.
Because with alloimmune causes, it's because you and your husband share certain genetic similarities involving the transplant gene called DQ alpha.
Yes.
And when that happens, in order for an embryo to attach, you must bear in mind, the embryo has to be dissimilar from your body.
Right.
So if there's a sharing of the gene coming from your husband's sperm into the egg and making the egg an embryo that is too similar to your body, because there's a shared DQ alpha gene, then your body will view it as an invading organism and immediately try to reject it. And the way it rejects it is by releasing the natural killer cell cytokines, the Th1 cytokines in excess.
Yes.
And that's what happened probably in your case
in the first
before.
Yes.
So by dealing with that problem, by calming down the natural killer cells, putting back one embryo at a time, and you only had one, so we were in a bit of a spot.
Yeah.
We were able to overcome the problem, and you were able then to achieve a viable pregnancy, which was going to go smoothly were it not for the cervical incompetence, which we then dealt with. And you were on the intralipid therapy to keep the natural killer cells under abeyance for a period of up to the middle of pregnancy.
That's right.
Along with prednisone.
Yes.
Those two together have to be given together to help the natural killer cell problem, and you were able to get through this and have a baby. That's the history.
That's right.
In a nutshell. I think we discussed this at length before.
Yes, we did.
So that's the story.
Yes. Oh, that was so many different issues.
There are, but you were blessed, and as I said before, no matter how smart we think we are, we don't create life. We create circumstances. It's up to the good Lord to decide, right?
Yes.
Tell us about what you felt like when you went into labor, what your doctor was like, how things went for you.
So my doctor is the OBGYN. He was I knew that everything that was at stake here in terms of the pregnancy. So I really needed a good doctor that carefully monitored me. And so my doctor, my OBGYN, knew everything. He was also somebody that went through IVF himself, and he carefully monitored my progress week after week after week. and even spoke with you about this whole, the whole
I remember.
yeah, he called you to make sure he understood everything that was going on. And he was a really great advocate for me throughout the entire pregnancy. And partly because he was monitoring my cervical length week after week. And in my first pregnancy, my son was born 36 weeks. My firstborn was born 36 weeks, but nobody was really measuring my cervical length to see if there was any kind of cervical incompetence issue. But then at 21 weeks, it started dipping below, 2.5, and it was dropping, consistently for, a few weeks.
This is the length of your cervix.
Yes. So, and they could do a cervical cerclage up to 24 weeks of pregnancy. So I was just at that 23 weeks that they were able to do it. And so I called you and I said, Dr. Sher, I'm getting so concerned about this. And, you told me, I think you should have your cervix stitched closed. And my OBGYN agreed with that. And he convinced the high risk doctor there's so much at stake here with this pregnancy. And so, with all the fertility treatment that she's gone through, her diminished ovarian reserve, this is her own egg, there's a lot at stake here. So we really think that she should have a cervical cerclage to have her cervix stitched closed. And the high risk doctor approved it at that point. So I was so thankful. If that didn't happen, I'm not sure I would have made it all the way. So,
I doubt it.
yeah. So,
Well, go ahead.
yeah. And then the labor itself, I had a cesarean section. My baby was almost 9 pounds. He was 8 pounds,
Big one.
8 pounds, 10 ounces. And he went all the way to 39 weeks. And, I had like I had a 3rd-degree laceration with my first pregnancy. So I elected to do a C-section on this one. So, but he came out and he's a beautiful boy. My older son loves him, and we are so thrilled and excited. Like, he's about a month old now, and I mean the labor was fine. He came out after they did a C-section. Within an hour, and my baby boy was born. I heard him crying, and I was in tears when I heard him, like, because it was such a long journey to have him, and I
God
mean,
bless you.
yeah, from that January when I knew that, he was the only euploid embryo that I had, I knew I had to give him the best chance of pregnancy. And that's when when I called you, Dr. Sher, I didn't, like the previous fertility doctor didn't really know what the cause was and why, I miscarried the first time. And, I, I was in tears, like, because I really thought I was going to get pregnant that time. And then I only had one embryo, and then, one euploid embryo, and me and my husband both, we thought that it wasn't going to happen. We thought that the first embryo, because it was a euploid embryo, we're going to get pregnant. And, and it didn't happen. And so then I started losing all the hope that, I was like, I don't know if this is really going to happen. And so then, when I found you, Dr. Sher, like I saw you on Dr. Amy's on the Egg Whisperer show, and you were talking about recurrent miscarriages, women with recurrent miscarriages, and then I was like, I need to call this doctor, And that's when I heard you speak on that, I was like, I need to find the person that's going to figure out what my problem. What I was like, I'm not transferring this embryo until I know what the cause is, and so when I called you and then you explained all of that to me, and then we did the immune testing, and the immune testing confirmed that I had an alloimmune disorder, I was like, okay, I have to go with the doctor that is going to give me the best chance of pregnancy, with of course the Lord, allowing this to happen. But and this for me and my husband, this was like the last. We couldn't go through any more fertility treatment. It was so much, like in terms of 10 rounds of treatment. It was so emotionally exhausting for both of us. And this was the last shot. I don't think I could go through this anymore.
Well, I'm so happy for you, really. My heart goes out to you. Really, I'm happy for you. I can only tell you that whenever, I've been through this a long time.
Yes.
I don't think anybody alive has done more IVF than I have
Yeah.
in terms of time. And this started many years back, maybe 35, 37 years ago.
Yeah.
And I've been influential in the birth of probably more than 17,000 babies. But with every baby born,
Yes.
it just fills me with joy and makes me realize how blessed I am to be privileged to be able to do this work. It really is wonderful. It's great to speak to someone like you who's had feels like they've had such a good experience. Very often what we don't realize as doctors is that this is not just a technical experience.
Yeah.
It's an emotional roller coaster for
Oh.
patients, especially someone like you who's been through so much.
Yeah.
And the role isn't simply to get you pregnant, but to get you through this journey intact, emotionally,
Yes.
physically,
Yes.
and the whole team goes into that. It's not just Dr. Tortorella and myself. It's the nurses, it's the staff that greet you.
Yes.
It's the way in which you are dealt with
Yes.
to make you feel comfortable and safe.
Yeah.
I think I told you the very first time we met, I think I gave you my personal phone number.
You did. And
I give it to all my patients and I said, look, call me if you have a problem.
Yes.
If you don't call me with a problem, it's on you.
Yes.
But if you call me and I give you the wrong answer, that's on me.
Yes.
And so I'm glad you felt comfortable enough to call me so we could discuss the issues.
Yeah, I called you several times, because I was, and even just changing fertility clinics. It's a huge, big process. It's so time consuming and it takes a lot out of a person, like emotionally, financially, like there's so much time, and so for those reasons, you just want this to happen and sometimes it does and sometimes it doesn't. And we needed to prepare ourselves mentally that it still may not happen, so that was hard, but we're just so happy the outcome was a good outcome.
Oh, I'm so happy for you. Does my heart good. I can only tell you, a lot of people don't realize that it's not the cost of having a baby through IVF.
Yeah.
Isn't simply the cost of the procedure financially.
No.
It's an emotional cost which even is greater
Yes.
than the financial cost. You can make up what you lose financially.
Oh, yes.
But you can't make up the emotional trauma you go through. So preparing for this emotionally is extremely important, and that requires a feeling of mutual involvement between the doctor, the team,
Yes.
and the patient.
Yeah.
It's not just a question of going there because that's where you feel the expertise lies. You got to go there because that's where you feel safe as well.
Oh, yes.
And when you have the support emotionally that you need.
Yes.
I tell people that all the time. So I'm glad you felt that way. It kind of vindicates why I got into this field in the first place. I love people. I love talking to people. So does Dr. Tortoriello.
Yeah.
But dealing with people as humans, not just as a case, as a problem.
Yes.
People often ask me, they say, I've been doing medicine now for a very long time. And they ask me, has medicine changed?
Yeah.
And I say, yes. It's become much more pure technical exercise. It's no longer the feeling of the doctor sitting at the bedside, holding the hand of the patient, feeling that interactive process go through with a mutual sense of comfort. It's now a question of hitching you up to a machine, to some other testing apparatus to try to find out what's going on, and then leaving it in the hands of others to deal with you.
Right.
It's also the reason why Dr. Tortoriello and I work interactively.
Yes.
I always tell my patients, look, when you see me, you're going to meet Dr. Tortoriello for a free online consultation.
Yes.
And if after meeting him, which I know is never the case, but if you meet him and you don't feel comfortable with him, don't come to me, because I can't guarantee you that I will be the one with a hands-on experience, as I was fortunate enough to be with you.
Yes.
But oftentimes you'll end up with a doctor. And because Dr. Tortoriello and I have worked together for close to 20 years,
yes,
there is a two-peas apart type of relationship. We do things similarly.
Yes.
And so that makes it very easy. But if you don't have that relationship with all the people in your team that are caring for you, you're in the wrong place.
Yeah.
Shouldn't come to us.
Yes.
And that's what I tell I think I told you the same thing.
Yes.
When we started.
Oh, yes.
So that's really how it turned out, and I'm really delighted for you.
Yes.
You still have one embryo left.
I do have one embryo
which
left.
is normal. Have you thought about what you're going to do with that embryo?
Yes. We are going to transfer that embryo in a year or two once this baby is over a year, and making sure my uterine lining and everything is okay, before we do an embryo. I mean, I had a cesarean section, but just making sure that everything is okay and I heal properly. We're planning on transferring that embryo too. So I hope it will lead to another baby.
Well,
delighted, but we only God knows.
That's the true statement. Now, you initially had a problem with a thin lining.
Yes.
But when we basically put you on the right hormonal protocol for frozen embryo transfer, we had a lining of 10 millimeters, which
10
is
millimeters
excellent.
in thickness, so it was beautiful.
So anything over 9 is perfect.
Yes.
8 to 9 is a gray zone.
Yes.
Under 8 is a problem.
Yeah.
But the reason your lining was good, I like to think, had to do with the protocol we used for the frozen transfer.
Yes.
Many doctors use oral estrogen.
Yes.
In the form of estrase.
Yes.
In my opinion, that's not a good way to go, because anything you take by mouth is absorbed and passes through a venous system called the portal system from the gut through the liver, and then it reaches the systemic circulation to get to the uterus and cause the lining to grow.
Yeah.
Well, when you take oral estrogen, it comes through the liver changed and altered. Yeah. When you do it and you give it directly into the systemic circulation by injection twice a week through slow release like we gave you, it goes directly into the systemic circulation and has a better effect on the lining. I think that was a factor that improved the response of your uterus to the hormonal treatment.
That was the best lining that I had. All the previous cycles that I did, they always but it was always like a thin lining in terms of it was over 7, but some cases it was 8, some cases it was 9, but this was the best, the optimal, and we had a good embryo to transfer.
That's true, because if you give it by injection or by skin patches, it absorbs directly into the systemic circulation, goes directly to the uterus. So what you got was delestrogen injections twice a week, and they slow release, and that way it's better than the patches. Patches can fall off, you can perspire, and then absorption is compromised of the estrogen through the skin. Whereas if you give it under the skin with a little shot, which is like an insulin injection, and not painful or problematic, on a Tuesday and a Friday, it absorbs, and you can measure the blood levels of estrogen, and you can do evaluations by ultrasound of the thickness of the lining and come up with a good result, which is what happened with you. So I think that's what you should contemplate for your next transfer.
Yes. It's frozen at Cher.
Well, one thing you've got to do is send us photographs of your baby.
Of course, yes.
We'd love to see those.
Yes, of course, and I
as the baby grows.
Yes, my little boy. We're so excited, and it's like this miracle, because he was that immature egg, and he was extracted, and like if we didn't do IVF, he wouldn't be here,
That's true.
So
well, it's such a great pleasure to see you again.
Yes.
I wish you all the best.
Yes.
Please stay in touch. Don't think that it's gone and over. No. Send us pictures.
Yes.
Give me a call. You've got my number still.
I do.
Call me anytime. Let me know what's happening with the kid.
Yes, I will. And we will be back,
It's been so long I've been doing this.
Yeah.
I have now got IVF babies of mine that are going through infertility treatment with me themselves to have babies. In fact, I have a case here that's quite interesting.
Yeah.
I have a prospective mother and father. Both are IVF babies of mine. And they got married.
Oh my God.
And they are going through infertility treatment with us.
Wow. That's
Talk
amazing.
about a rarity. That'll be a first, I think.
That is definitely both babies or IVF babies of yours, and now they're going through infertility. the, the probability of that.
It's like incestuous, right? It's like incestuous. Well, I'm delighted to see you again, see a big smile on your face.
Yes, I'm so happy that God gave you this beautiful gift of helping people with their families, and we'll be forever, like, forever in happiness and grateful to you for this.
Thank you so much. Yes. Really happy. God bless you, and thank you for joining us today.
Yes, God bless you too, and the entire organization. And I tell them all I'm so thankful for everything. I know that
Will do.
God works things when it's the right time, and it happened for me.
Thank you, Annette. Really appreciate you.
Yes. Okay.
God bless.
You too.
Bye-bye.